Hi, my name is Nisha Downs, and this is my contemporary communication issue speech. Imagine telling someone something important, a message that you needed to convey. This person not only understood what you said, but was then able to assist you in any way that they could. Now imagine trying to tell that person the same important information, but instead that person didn't understand and couldn't help you. Now imagine that you're a small, dependent child in that scenario. Can you feel the frustration and anguish overcoming you as your parents and teachers can't understand you? This situation is very real for children with speech and language disorder, and this frustration often turns into bouts of tears and lashing out. Behavioral issues and language delay go hand in hand for obvious reasons. What are speech and language disorders, and what are the causes? A speech and language disorder is when a child's language is developing in the right sequence, but at a slower rate, as quoted from the University of Michigan Health website. A speech and language disorder deals with abnormal language development. This problem occurs between 5 and 10% of preschool children. This is caused by the brain working differently. It has trouble producing speech sounds, using spoken language to communicate, and understanding what other people are saying. There are many causes, the top being hearing loss. It's an extremely overlooked issue, but it's extremely important, and a lot of these are caused by chronic ear infections, which are common in young children. Prematurity. However, premature babies should be caught up by the age of 2. Multiples. 50% of multiples have some language delay due to prematurity, low birth weight, or medical intervention at birth. Auditory processing disorder. Problem decoding speech sounds. Neurological disorders. Cerebral palsy, muscular dystrophy, and traumatic brain injury, and each of which affects muscles that are needed for speaking. Autism, and apraxia of speech, which is difficulty in sequencing and executing speech movements. All of these are very common in young children. All of these are things that are very commonly seen in children with behavioral disorders. Behavioral disorders can emerge in children who are language impaired because of poor communication, frustration with work, and special difficulties, as quoted from Dr. Chong Shang Chi. As a 2-year-old teacher at a special learning or an early learning daycare, I experienced lots of different behaviors. I had 3 students in my own group, each suffering from a speech and language disorder and delay. Gabriel had severe hearing problems. Gabriel was seen hitting, kicking, biting, screaming, throwing toys. He was aggressive with the intent of hurting his peers. He did not understand the instructions for assessments. He did not understand any basic instruction whatsoever. He spoke in a very high-pitched voice, often in screeches. And the only way to honestly get any kind of message across was to use simple sign language, like sit, water, please. Excuse me. As Gabriel went through these different assessments and we saw that he was behind most of his peers, his parents then took him to an ear, nose, and throat specialist, and they found out that his ears were so full that he was basically almost deaf. He could not hear anything, which explained the tone of his voice and the pitch of his voice, why he couldn't understand us when we told him what to do, why he was having trouble following instructions. He has now undergone surgery, removed everything in his ear, and he not only has the tone of his voice changed, but he is doing much better and is receiving higher marks. Derek is another child who was hard of hearing. He had trouble following directions and got frustrated very easily and had frequent tantrums. He had a slight speech impediment. He said things like milk instead of milk and things like that. and that is an obvious hearing issue. So when he was sent to the ears and nose throat specialist, they're now taking measures to help fix this, but there's the only ways we can help him in the classroom are patience, repetition, and continuing to speak to him no matter how frustrating it is that he doesn't understand. Rachel was a premature baby. When we got her at the daycare, she did not speak at all. The only noises she ever made were shrieks, whether she was happy or sad or hungry or tired. She could point to colors when she was asked. She could point to pink if we asked her to point to pink, but she could not recall what the color was verbally. All of these things ended up in frustration for her, and she cried frequently and threw lots of fits and screamed and ran away from us. And in about 4 months, with lots of patience, work, and time put in, Rachel went from literally not speaking to now she speaks in full sentences. Speech pathologists have worked with all 3 of these children and have made quite a difference. Things that they have done to help these kinds of children: read out loud, sing different songs, ask open-ended questions to invite conversation, blowing bubbles as a fun way to develop oral muscles needed for talking for those children who suffer from things that inhibit them from talking, such as the neurological disorders. Play telephones also encourage talking, and they can mimic what mom or dad or teachers say and do on the phone. Teach simple signs from American Sign Language to help communicate things like sit and please, help, milk, water, the simple things that every child around the age of 2 say in order to convey what they need to those who need to know. And also, one of the most important is to use the correct inflection in your voice and hand gestures to convey the meanings. Don't speak with your hands just haphazardly when you're speaking directly to a child. When you're angry, no. When you're sad, yes, good job. Encouragement and correct inflection truly help to just communicate with these children in a way that is nonverbal. Verbal communication is one of the most important connections made between human beings. The ability to do so is something that is often taken for granted, made obvious by those children who struggle to communicate even the simplest of things. It is easy to understand how such a problem can have a negative effect on behavior of a child with a speech and language disorder. There are many things one can do to help. However, the most important is to have patience.